When studies show that up to 30% of women experience some form of anxiety or mood disorder during pregnancy or postpartum, including postpartum depression, obsessive compulsive disorder, and even PTSD, something isn't right. Hi Mama, and thanks for joining me today. I'm Tara from Postpartum Nurturing, and today we're chatting about postpartum mental health. So it really started way back in ancient Greece and with ancient religion as well, and it's far too much to go into here, but it has shaped modern medicine today. The focus was, and it is today, often about treating diseases and that the body and the mind are separate, rather than focusing on maintaining health physically, emotionally, and mentally. So the way that women were treated, if they were feeling anything from unhappy to experiencing psychosis, was truly atrocious. And this began as the influence of a male-dominated healthcare system started to form. Throughout history, mental health issues have been surrounded by fear, shame, and societal stigma. So even though we're raising awareness and breaking down these barriers these days, we have to understand that it doesn't erase, does not take out thousands of years of appalling treatment of women. So perinatal mood and anxiety disorders, it's also known as PMADs, which I'll call here for ease. It refers to a range of mental health challenges, and that can affect mothers from pregnancy to the first year after giving birth, and even beyond as far as I'm concerned. They include mood disorders like depression and anxiety and can disrupt daily life. So PMADs are currently primarily diagnosed using the DSM-5. It's a manual for mental health that professionals use to diagnose, and ironically it's written by 9 males and 2 females, so 11 authors all up. And it actually defines postpartum depression as occurring only within the first 4 weeks after birth, which is really crazy in my opinion. But luckily these days a lot more healthcare providers now recognise that it actually can extend up to the first 12 months. Unfortunately, PMADs they're quite common and affecting approximately 1 in 7 women. In Australia, around 13% of women will experience postpartum depression, and sadly, maternal suicides are one of the leading causes of death in the first year after giving birth. The rates of PMADs can vary widely between countries, and this is due to cultural views on mental health and even the level of support that's available to new mothers. And how's this? For example, in Japan, mental health struggles are often seen as shameful to a family, like you're a failure, whereas in Malaysia, mental health is acknowledged. And in fact, the government actually takes care of mothers. They're supporting them in postpartum. They have access to free services like pelvic floor therapists, mental health, home visits from nurses. Family members come and help them at home with cooking and housework. They're given nourishing meals and herbs, and there's breastfeeding support. And government even have paid leave for them for a long period of time. The postpartum depression rates in Malaysia is less than 3%, and in Japan it's around 10%. And I personally believe that the stats speak for themselves. So despite increased awareness and education about mental health in Australia and other countries, many mothers still silently struggle with postpartum depression, and it's due to the lack of support, the right nutrition, and the expectation that these issues are normal. So family history of mental health issues, traumatic birth, including unexpected outcomes like emergency cesareans, lack of social support, financial stress, relationship difficulties, and even experiences of abuse and trauma, they all create a higher risk of depression. And what's the difference between postpartum depression and the baby blues? So postpartum depression, can be a little challenging to distinguish from, like, just the irregular emotions and experiences that come with parenthood when we've got a new baby, and also what we know as postpartum as baby blues. But here's some general guidelines. So around 80% of mothers experience baby blues, and generally it's from hormone fluctuation, lack of sleep and support, and feeling overwhelmed. And you might feel sad and teary, overwhelmed, like you're lacking confidence a bit, you're tired, and it usually occurs in the first 2 weeks after birth. Overall, though, you have feelings of joy and moments of happiness and bonding with your baby. So baby blues is not considered a disease or disorder. You do still need support and nourishment. So make sure that you're eating nutrient-dense meals regularly and getting the help you need. Remember to download my free guide if you want some recipes there. Postnatal depression affects approximately 13% of women in Australia. Usually it's persistent daily. Symptoms for 2 weeks, such as deep sadness, hopelessness, fatigue, changes in appetite, dark thoughts, worry, insomnia, feeling worthless, and lack of interest in life. And why 2 weeks? Who knows? That's just what they've said. So postpartum depression is a diagnosis, and you need to seek help, professional help, as soon as possible. Some suggestions I have is to eat nutritious meals regularly, check your iron intake, have magnesium chloride or Epsom salts in your bath or foot bath, and get outside and get sunshine on as much skin as you can. And of course, get the help that you need. It's becoming more and more common, and it's far from normal. It's not your fault though. Seek help from a health professional that you can trust, that you can talk to openly, and know that you're going to be helped in a supportive and respectful way. Just being handed pills and told it's normal is not acceptable. But of course, listen to your healthcare provider if medication is required. Of course, you need to listen to that, and also get the help with the nutritious meals, the sleep, and anything else you need. Do it together. Don't just rely on the medication. You can also rely on me to help point you in the right direction, or guide you through a like a nutrient-dense meal plan, or just for someone to talk to. That's why I'm here. So reach out to me if you need help, and I'll talk to you soon and see you next week. Bye for now, mamas, and I hope that was really helpful. Let me know if you've got any questions.